Okay, well, it looks like we've got a pretty good group signed on. So again, this is Aaron Mornham with the Montana Healthcare Foundation. I'd like to thank all of you very much for joining our 2016 Call for Proposals webinar. Today we're going to just cover the basics of the Call for Proposals and try to leave a good amount of time for questions and answers at the end. I'm going to go over some technical logistics for the webinar. If you're hearing any echo or feedback, mute your computer speakers and try dialing in on a phone line. Here's the phone number and call-in code, 415-655-0002, with the code of 622-987-965. We are not going to be taking questions verbally just because we found that it can be difficult to control feedback on the line when we open the line for questions. Instead, we'll use the Q&A feature of the WebEx interface. You should see a Q&A button on the upper right of your screen, and then you can type a question, and we will be answering those when we get to the Q&A. You can type your question anytime during the webinar. When we get through our side of the talking to you, then we'll get to answering all of those questions. So I just want to introduce you to our team at the Healthcare Foundation. I'm Aaron Mornham. I'm the CEO. I'm in the room today with Ted Madden, our Chief Operating Officer, Scott Malloy, who's our Senior Program Officer, Melinda Buhite, who's our Communications Coordinator, and Kayla Talbert, who's our Grants Administrator. So just a few logistics. We're going to spend about half the time today talking over the call for proposals, trying to explain a little bit more in depth about what you've hopefully had a chance to take a look at in the written call. The last half of the call we're going to use for an interactive Q&A session. Again, we want you to submit those questions by typing into the Q&A feature in the WebEx window. And after the meeting today, we'll send out an email with the slides from today and a link to the presentation which we're recording, as well as responses to any unanswered questions from our Q&A session. Again, what I'll emphasize several times during this call, I really hope you'll all take away, and that is we're here to help. We aim to make this application process streamlined and as simple as possible. We know it takes a lot of work to put together a good grant proposal, and we really do want this to be as simple as possible. Please don't hesitate to email us or call us if you have questions that don't get answered today. And again, this is just a little more on how to ask a question, so showing what the WebEx interface should look like on your computer screens and how to ask a question of us. This is a quick look at what we'll cover today. We'll talk a little bit about the background of the Healthcare Foundation, who we are and what we do. We'll talk about our eligibility and selection criteria for grants. We'll talk about each of our 3 major focus areas and how to work the online application system. And we'll try to leave nearly half the time free for questions and answers. Our goal today are to help you understand our focus areas and our approach to making grants. Really, again, as I said, want to make it as easy as possible for you to submit an application, and if you're having any trouble either with understanding the questions we're asking or with the online application system, we urge you to get in touch with us. We try to be as helpful as we possibly can. So I'll start with just a little bit of background about Montana Healthcare Foundation. We are Montana's largest foundation devoted to improving health. We make strategic investments to improve the health and well-being of all Montanans. We have a major focus on at-risk populations and health disparities. We're meant to be a permanent resource for Montana, so we have roughly $100 million invested. We make grants and other investments of roughly 5% of the value of those investments each year, the hope being that income from the investments will sustain us for a very, very long time and allow us to continue this work in perpetuity. The foundation was created from the sale of Blue Cross and Blue Shield of Montana. There are probably nearly now 300 conversion foundations, which is what we are, around the country. Most states have them, and they tend to arrive whenever a nonprofit is sold either out of state or sold or converted to a for-profit health system. We have no relationship to Blue Cross anymore. We're an entirely independent private foundation. Give you a little bit of an overview of the 2016 call for proposals. We'll be offering roughly $3 million or potentially a little bit more in 1 to 2 year long grants in 3 major areas of focus. The first is behavioral health, and that's a term that we use to encompass both mental illness and drug and alcohol use disorders. Within that, there's an integrated behavioral health initiative that we'll talk to you a little bit more about in detail. Our second major focus area is American Indian health, and our third is partnerships for better health. We'll be offering 2 types of grants. The first is a rapid response grant. That's a one-step grant application for grants of up to $25,000 for a 1-year project or up to $50,000 for a 2-year project. We intend these to be, really a fairly simple application process with a pretty quick response to the proposal. People may choose to use this for smaller scale initiatives or for planning grants or other applications like that. Our larger grants are from $50,000 up to $150,000 for, again, up to a 2-year project. That will involve a 2-step application where you submit a brief proposal, and then if you're invited to, if you're one of the stronger proposals we receive, then you'd be invited to submit a full proposal. Each organization can submit up to 2 different proposals on different topics. It doesn't do you any good to submit the same topic to 2 different focus areas or 2 different initiatives, but you are welcome to submit up to 2 proposals on 2 different topics. These are our eligibility criteria. Again, we urge you to go to the links on these pages and read the entire call for proposals, but we'll hit the high points here. Eligible organizations include 501c3s, except for 501c3s that are categorized as private foundations or type 3 non-integrated supporting organizations. These are definitions provided in the Internal Revenue Code at Section 509A. Tax-exempt educational institutions and state, tribal, or local government agencies can also apply. As a note, for the American Indian Health Focus area, there are additional eligibility restrictions. For that area only, tribal government agencies and American Indian-led 501c3s are eligible. Eligible applicants can use part of the budget for contracts with an entity or person that might not be eligible to apply. So if you have an individual you'd like to use as a consultant or an out-of-state organization that couldn't apply for a grant on its own that you'd like to use as a consultant, you can include that as part of your grant budget. And we're more than happy to talk you through the details of that. Basically, we wouldn't support a proposal that sought to use 100% of the budget for a non-eligible consultant. We don't want to be giving pass-throughs. We want these grants to be supporting Montana organizations. But we also recognize that you may need consultants to help you with your projects, and you're welcome to budget those into your grant application if you're eligible to apply. This is a list of things that we will not fund. These are restrictions on what our funding can be used for. So we don't fund individuals. They don't meet our eligibility criteria. We don't fund capital campaigns or fundraising events. We don't fund the retirement of debt or operating deficits. We are not currently funding construction projects or other capital project work. We are evaluating whether the foundation may do this in the future. We recognize this is the area of great need in the state, but it's a complicated set of criteria to think about under what circumstances, what sort of investments we would make in construction, and at this point we're just not doing it. Organizations that discriminate for any reason, we will not fund. We don't fund lobbying. We don't fund political activities as defined in the Internal Revenue Code, and these are restrictions on all private foundations. We don't fund large equipment purchases, but I'll give you a little bit of a nuance there. If you need to buy equipment as part of your grant, but that's not the major purpose of your grant, we can entertain that sort of request. So for example, if you need to buy computer systems for employees, but the main funding is going to other programmatic work, that may be an acceptable expense. We don't fund medical research or research that lacks a direct, targeted, and practical benefit to Montanans' health. So some of our projects are somewhat research-oriented, but most of them are, actually, let me revise that and just say all of them can demonstrate that they will have a direct and tangible benefit for the health of Montanans. We're not primarily a research funder. And we don't fund organizations or foundations that would like to redistribute our grant via subgrants. We have one special restriction that's in state law. The Montana Healthcare Foundation grants may not be used by grantees to supplant government funding. And we'll make a very important distinction here between supplanting and supplementing. Supplanting means that you would use our funds to replace funding from that you have from a government agency already. So it means you get a grant from us and then take your current government funds and do something else with them. You can't do that. You can supplement. So if you have current funding for a program, but you apply to us for funds that would allow you to do something more or new or different, maybe related to the current program, but it's not going to take away anything from what you're already funded to do. That's supplementing, and that is allowed. There's a white paper on this. All grantees are required to indicate that they've read it when they submit a grant application, so we urge you to take a look at that. Our selection criteria are really the lens through which we look at everything we fund and everything, even the way that we spend our own time. We urge you to read these in detail. This is a list of the main topics under the selection criteria, but we've described each one in detail, and we'd urge you to go to this link. This is one of the more important pieces of this presentation and one of the more important parts of the call for proposals. So first of all, we look at the importance of the health issue. What can you say that indicates why you're choosing to focus on the particular issue that you'd like to? The second is how severe is the need for the work that you propose to do? Are there other resources that could support it, for example? This really allows us to try to even the playing field between communities that may have a lot of resources already and certainly can make a case for need, but may also have a lot more available to them, and some of the small rural areas and tribal areas that have fewer resources. So we really do look at need as a major part of our way of deciding on what we'll fund and what we won't. The potential for lasting change or sustainability, this is a very important criterion for us. A lot of the programs that we fund, what we're looking for is a strong business plan for how would you sustain the work that we help you start after our grant is over. We really don't want to start a wonderful program that would be dependent on us forever after for grant funding to continue. So we look to people to be thinking creatively about, well, will your services that we help you get started be able to be supported through, for example, billing third-party insurance? Could you form some sort of a cooperative agreement with a hospital or one of the payers where you think that you're going to be improving health outcomes and saving them money, and where maybe they would become a funding partner? So we urge you to think creatively about sustainability. We're happy to talk you through that, but this does put a limit on some of the projects that we'd like to fund, but just simply cannot be in the business of funding permanently. We focus very, very intently on partnerships. We don't want partnerships that are sort of in name only, or a list of organizations that you're already working with. We focus on using our grants to create new partnerships or strengthen existing partnerships and allow organizations to do more efficient work through working together, and allow them to better serve their communities through a more intentional and deeper collaboration. We have a focus, as I said at the start, on at-risk populations and health disparities. We want to also have an idea of how practical your idea would be. Is this a solution that exists? Is there evidence that it should work? Is it workable in Montana? You know, if you're going to bring a great idea from a big city and, you know, like New York, what evidence do you have that it would work in a more rural location? We also are absolutely willing to fund culturally adapted programming or ideas that you have for making something more relevant to a Montana community and adapting it from elsewhere. We look at the feasibility and scale. We urge applicants not to apply for the maximum grant size just because it's the maximum, and we also urge applicants not to apply for $10,000 if they have a $50,000 project. We want you to apply for the right amount of money and really want to know that we want to take a look at whether this seems feasible for the budget that you have in mind. We also look at the ability to scale the work to other communities. If you're successful in your community, will this potentially be an important model for other Montana communities to address common health issues? We also look to have a diversity of topics and geographic regions and types of organizations and applicants. We aren't funding only, you know, large hospitals or large universities. We're funding very, you know, small community agencies, small tribal government agencies, small nonprofits, and funding around the state. So diversity is a very important piece of the way that we look at grant proposals. So that's a lot of information. Again, we urge you to look at the selection criteria online. This is a very important part of submitting a successful proposal. I'll take you through now step by step through each of our focus areas. Scott, do you want to start with behavioral health?
Thanks, Aaron. So the behavioral health focus area, there's clearly a lot of challenges that need to be addressed within this area. So this list is not meant to be exhaustive. It's meant to be an example of what the behavioral health challenges are, and also, you know, give some examples of what the foundation has funded and will consider. So we know in our state that we have some significant challenges, including high suicide rates, adverse childhood experiences. We have many challenges with our youth and adults with drug and alcohol use. And we also know that we have an extreme shortage of behavioral health providers. There's also reimbursement shortfalls across the board as well, not just in our frontier and rural areas, but also in our larger areas. We have a high veteran population and American Indian population, and we know that many of our veterans suffer from high rates of traumatic brain injury as well as post-traumatic stress disorder. We also know that we have a big state, and there tends to be a fragmentation of care within our health systems, which creates some challenges in communities to be able to provide effective services for the people that live there. So again, this is not meant to be an exhaustive list of what we will fund. This is some examples of what we have funded in the past, and I want to make sure people go to our website and really look at the summaries of the grants that we funded last year to kind of get a sense of what we have already funded. The Integrated Behavioral Health Initiative, I'll go through that in the next slide. I want to point out that this is not the only thing within behavioral health that is available. Again, there's a variety of things within behavioral health that need to be addressed, and the Integrated Behavioral Health Initiative is one thing that is available this year as a structured initiative from the foundation. As Aaron pointed out, we really understand the importance of a community increasing the partnerships and collaborations that are in their community right now, providing direct healthcare services, but also more upstream partners like housing, transportation, and other social service organizations. So anything that would help strengthen these partnerships to deliver better health care is really important. We also recognize that schools right now provide a wealth of health services, and there's some that also struggle to even bring in the most basic health services. So any partnerships that enhance or increase the school's ability to do that is very important. In addition to that, trauma-informed schools, being able to look at how to effectively work with kids in a way that is not punitive but more trauma-informed. Jail diversion pilot programs, again, approaches that seek to, help people before they hit the criminal justice system, but also if they hit the criminal justice system, ways to make sure that they get the help that they need. Prevention and treatment for drug and alcohol use in pregnancy. And again, as I mentioned, any partnerships that are outside of the traditional health sector so that we can address the behavioral health issues in a more proactive manner. Getting into specifically the behavioral health, the Integrated Behavioral Health Initiative, we define this term as a team-based approach that integrates primary care, mental health, and substance use disorder treatment in order to improve health outcomes and value. So this is a structured initiative for us, and there's two opportunities for organizations. And the first is to provide planning grants. And so this is a one-year planning grant that is up to $35,000. Part of the $35,000 includes in the budget, training and technical assistance by an organization with significant expertise in integrated behavioral health. This is a great opportunity for organizations that are not currently engaged in any integrated behavioral health activities. It's a way to plan and look at how this could be rolled out in your organization. It is also a good opportunity for organizations that are already engaged in integrated behavioral health. So they might already have some services or activities that are occurring, but they really need some money, some technical assistance, some training to enhance their current services to get them to move more towards full integration. The second opportunity available is for implementation grants. These are two-year grants up to $150,000. And again, part of a structured initiative to have training and technical assistance by a national organization. These implementation grants are really for agencies that are not currently engaged in any integrated behavioral health activities. And they're really able to express a deep commitment and partnerships to not only plan, but to implement the integrated behavioral health within their organization. And so this not only provides for training and technical assistance, but also some expenses for FTE and other related expenses to help them get the integrated behavioral health program up off the ground. Some examples of these, again, not an exhaustive list, but it could be collaboration amongst a variety of health partners, including primary care clinics, behavioral health providers. Again, this includes mental health and substance use, hospitals, tribal health and schools, correctional settings. Again, I encourage everyone to look at our current grantees to get a flavor of what was funded last year. Anyone who's funded as part of this behavioral health initiative will become part of a cohort. So with our existing 2015 grantees and any 2016 grantees that are funded, they'll be part of a cohort that receives training and technical assistance, also webinars from national experts, and also learning communities, which is developing a peer community so that organizations that are doing this can really share in the lessons learned, successes, and challenges. There'll also be an evaluation component to the implementation grants to make sure that we can really clearly define what impact there is on a quality level as well as cost. It's very important to make sure this initiative is successful moving forward.
Okay, thanks a lot, Scott. So let's talk now a little bit about the American Indian Health Focus Area. We have spent a lot of time over our first year and a half of operations getting to know the tribes, working hand in hand with tribal health directors to understand what their needs are, working with some of the urban Indian health centers as well, and really trying to map out where are the needs and where can we be helpful. Anything that I'll say about our work in American Indian Health is guided by what we've heard from the tribes and tribal health leadership in the state. And again, anything that you don't see on this list, we're perfectly open to. These are just some examples of some of the key challenges that we've heard in talking with American Indian communities in Montana. Inadequate funding of health services is a national problem for Indian health, and it's been a major problem in Montana as well, and a long-standing one, and inadequate funding of prevention efforts as well. Prevalent drug and alcohol use disorders and limited availability of treatment. as well as drug use and pregnancy, have come up frequently as community concerns. Challenges facing young families, including historical trauma, lack of economic opportunities, and adverse childhood experiences. Problems of injury risk, traffic injury with drug and alcohol use or driving under the influence being one driving risk factor and another being relatively low seatbelt use. Diabetes, obesity, and limited access to healthy foods have come up in many communities that we've worked with. Prevalent oral health issues, and suicide and mental illness. So again, this is a list of challenges that people have identified. It's not meant to be an inclusive list, and we welcome continued opportunities to work with tribes and tribal health leaders to identify their needs and figure out how we can best work with you to fill them. Examples of projects that have really been a high priority from applicants over the last year, and I very strongly urge people interested in the American Indian Health Focus to look at our current grantees, because I think it gives you an idea of the spectrum and creativity and needs out there. But these are some of the types of projects we've seen as being a really high need. Helping tribal health departments strengthen funding and programming, so through, for example, technical assistance with Medicaid billing, through an effort to develop centralized billing and coding, through using public law 638 to contract or compact with the IHS to provide services that the IHS is currently providing. Sometimes we're providing just grants to carve out some staff time for health system planning, to think a little bit about where do you want to go, and then recognizing that this is not the only year we're making grants. This is only our second year, and we'll be here for the long haul. So, if we have a good planning grant one year, this could turn into then a larger funding effort in the future. Projects that seek to improve maternal and child outcomes, injury prevention programs that can be sustained beyond the grant. We funded one tribal injury prevention program this last year with the hope that the tribe will then be in a great position to tap into sustainable funding through the Indian Health Service and Centers for Disease Control, which provide ongoing funding for tribal injury prevention efforts. Strengthening health services for urban Indians, and culturally specific disease prevention, treatment, and wellness programs. So we've often been asked, if we want our grants to be evidence-based, will we accept proposals from people who want to do, more culturally tailored disease prevention or wellness or treatment efforts? And the answer is absolutely, as long as you can make a strong case for why you think this would work. So lastly, I'll talk about partnerships for better health. This is sort of our broadest focus area. We're focused in this area on improving value through partnerships and innovation. So examples of some of the challenges we've heard around the state: limited access to health services in rural areas, workforce issues where it's very hard to recruit and retain staff, particularly out in rural and frontier communities in Montana. Funding is, again, a challenge with low reimbursement for mental health and substance abuse treatment. Rising per capita health costs are a major issue in this state. I think we saw a report recently that showed Montana's healthcare costs had risen faster than all but about 9 states. Super utilizers are patients who frequently come back and back to the emergency room or hospital and aren't necessarily getting the care that would help them have better health outcomes and need that expensive care less often. And then health disparities and what we call the social determinants of health, the challenge of improving health against the current of poverty, poor housing, and poor educational outcomes. And so these are all challenges we've been very engaged in over the last couple of years. Examples of the types of projects in this portfolio that we would consider: so community health teams and other forms of community outreach to take clinical care beyond the walls of the hospital or the clinic and out to help people meet their needs at the community level. Addressing upstream risks and social determinants. So, for example, we've done a couple of grants related to housing needs for high-risk populations and trauma-informed education, as Scott mentioned, under the behavioral health portfolio. Collaboration among community agencies to give better, more effective, and stronger services, so local health departments, hospitals, community health centers, county health departments. How can they work together better to address the workforce needs, the budget needs, and strengthen the services that they're providing? And oral health programs, again, this is a need we hear about frequently in Montana, and we're very interested in looking at ways that we can support programs that could ultimately become self-sustaining and deliver prevention and treatment to communities that need it. We also, in this portfolio, look at Medicaid expansion and what we can do to support a successful implementation effort by supporting enrollment, navigation, and effective use of insurance. So we're going to talk a little bit about how to apply. I'll turn it over to Ted Madden.
Thanks, Aaron. This is more the technical knowledge of how to use our online grants management program. So all our applications reporting is done through a third-party program called Fondant. You might receive an email from grantadministrator.com. They're the same thing. So to access the system, the best way is to go to the Montana Healthcare Foundation website homepage. You'll see on the upper left a button to access our grants login link. And when you click that, you'll get to this screen. Go ahead. And so you see our same logo, but actually you're in a third-party vendor product that we're very happy with. The main thing here is the email address is the primary login. And so we just encourage you to look for your organization to see if you already have a user account and who that might be, because it is email specific. And if you need to change that, or somebody else from your department or organization is applying, we can easily change that on our end. It will require a call. If you're a new user, feel free to just create an email address and a password and create a new account as indicated there. That's perfect. And as you log in, for some large organizations like the university systems, it's helpful when you create a new user to put Montana State University - what department you're with. And just be as specific as possible when you put your organization name down. Once you log in, you'll see the Apply button, and that'll give you our list of applications that are active at any one time. So right now we have 8 applications active right now. Our first cycle of rapid response proposals, and then also our large grant proposals. If you click on one of those, you'll see this cover sheet, and we ask for some standard information. I'll walk you through each of the different areas of questions. The questions on the applications will vary a little bit, but this will give you the general guide of how they work. You click on those arrows, you'll expand the different question categories. The first is primarily about the eligible organization type, checking off to make sure that you've read all the eligibility criteria and our supplanting memo, and that'll give you the access to go forward, or that'll allow you to go forward. On to your project title and summary, broad description of your project title and project summary. This will be used to sort our grants and to know what type of areas grantees are interested in applying to. And from there will be some demographic information, pretty self-explanatory, check boxes, and other populations to be served. And then we'll move to the meat and potatoes of the application, the project description. There'll be several fields, and again, referring to our selection criteria will be quite helpful here, because that's what we'll be looking for in these responses about the health issues, the specific activities, outcomes, sustainability plan, and how you're going to evaluate the success of your project and any foreseeable challenges. So that'll be the bulk of the application, and then it'll go into the financial portion of it, the budget for the project, and the term and the amount requested, the other support for the project, and for the rapid response, you'll see a budget template to download and complete. And for the large grant application, there will be a 2-step process. The first step, you will not have to will be more of a description of the activities and how Montana Healthcare Foundation funds will be used. And then if you're invited for a full proposal, then we'll request a budget template. As you fill those out, feel free to call with any assistance in terms of answering any questions or how to navigate the online grant management system. Kayla Talbert or myself will be happy to help.
Thanks very much, Ted. Excuse me. So here's just a little bit on the logistics of applying. For the rapid response grants, we're going to have 2 rounds and possibly a third. So if you missed the first deadline, you can apply for the second. The first deadline is March 15th. You can apply anytime from now up until then. And then we're aiming to get funding decisions out by approximately April 15th. We'll certainly let you know what's going on by then. For round 2, it'll open in May 1st. Proposals would be due by June 15th, and we'll aim to make funding decisions by approximately July 15th. And then round 3, if we have funds available, we'd be looking at opening a call September 1st, proposals due October 15th, decisions by approximately November 15th. For the large grants, the call for proposals is open. You need to submit a brief proposal, which we hope is really a pretty simple proposal to do by by April 15th. That's when the brief proposals for the large grants are due. We'd be making decisions on those brief proposals by about May 15th and inviting full proposals from the strongest applicants. We'll give you the next couple of months to do those full proposals and then would ask for the full proposal to be submitted by August 15th. We would be aiming to make a final decision on funding by the end of September, and then hoping that projects would get started no later than November of 2016. So we're going to go ahead and start the question and answer session. I see we have a few questions already. While I'm answering those, please type in any more questions, again, using that Q&A function. One thing to just note, we try not to answer questions about whether a specific proposal might be viable or not. We really need to have the proposal in front of us before we can evaluate that. But we're happy to talk you through the selection criteria and how they might apply to the issue you're interested in working on. And as a reminder, we're not going to take verbal questions, so just please type into the Q&A, and we'll do our best to get through all the questions we get. If we don't, we will answer them by email after this session. Okay, so we have a first question that says, please explain the difference in selecting to submit under behavioral health or integrated behavioral health. So I'm hoping that the webinar has helped explain that, and I would also really urge you to read the behavioral health section of the call for proposals pretty clearly. The Integrated Behavioral Health Initiative is for those organizations that want to plan and or implement integrated behavioral health delivery. So that means putting primary care along with behavioral health providers, co-located, fully integrated services, a team-based approach to caring for the whole patient. If that's what you're after, the Integrated Behavioral Health Initiative will provide grant funding as well as technical assistance, training, and evaluation support. If you have any other behavioral topic, and there are many, then you might want to look at applying just to the behavioral health focus area outside of that integrated or IBH initiative. Let us know if that doesn't answer your question. We're happy to take a follow-up or talk to you offline. So second question that we have here is, please define organization further. Is this, for example, a whole tribe as one organization that could apply for up to 2 grants, or can individual departments of the tribe apply for up to 2 apiece? So this is a tricky question. We've been asked this by, for example, the state government. So is the state of Montana one agency or one organization, or would we take 2 proposals from the health department and 2 proposals from let's say the Department of Environmental Quality if they wanted to apply. And we are still working to define the answer to this question precisely because we don't think we've seen all the examples yet, but I will tell you we've told the state that different government agencies can be considered separate organizations, so I think that should apply to tribal governments as well. We've also seen, for example, at universities, we've been asked there whether different departments of a university could apply, and there we've said the university is one organization, 2 applications, but we've also found we've had a university apply for 2 and then a university foundation apply for another 2, so that was one way sort of around that limitation. We're happy to talk with you. Sorry not to provide more clear or exact guidance there, but I hope that answered your question. Okay, let's see. Will round 2 of the rapid response grants have the same focus areas and priorities as this current round? And the answer is yes. That was easy. So really nothing else to say there. We don't anticipate any changes. And we have another question for rapid response applications which are funded. When would the funds actually be available? So it depends on negotiating a grant agreement, so part of it depends on how fast that goes. What we would do is when we offer you, when we send you a notice of that your project is accepted, we'll send you a grant agreement. If the negotiation is quick, then we should be able to make those funds available very quickly. If legal questions come up in that negotiation, then there may be some time for back and forth. But we'd hope to get those projects started pretty quickly. So we have questions. Would you consider limited income population as being disparate? The answer is absolutely yes. And we, I believe, have a frequently asked question online that talks about this a little bit. I think it's maybe how we define at-risk populations. Income is certainly one. Income is a major determinant of health, as many of you may understand, and so we consider that to be a major risk factor. Question, when would we announce if the 3rd round of the rapid response grant is available? The answer there is we haven't really decided yet. It would probably be after we have decided on the 2nd round of rapid response proposals, and we sort of see how much is left. If one organization submits a rapid response application and then a large grant proposal for 2 separate but related projects under the same focus area, will those 2 projects be distinct enough, or should the 2 applications not be related at all? I think the answer to that really depends on the substance of the proposal. If they truly are a different project, put it this way, we'll be looking at them together. If they're separate but related projects, we would look at, well, you know, does one seem to fit your organization where you're at right now better than the other? So one place that's come up just as an example is we have gotten occasionally a proposal for a planning grant at a smaller level, and then a proposal for an implementation grant for the same type of work. And the question that comes up when we look at those 2 together is, well, if they need planning funding, are they ready for implementation? So we really would want to be, you know, thinking about sort of the scales and types of work you're proposing under each. But I think the answer is if they are distinct truly for you, you can apply for them that way. That was the last question we have, but please keep them coming. We've got about 15 minutes left, and we'll stay on the line for at least several more minutes and see whether anything else comes in. Again, if there are questions you don't want to ask and have answered on this call, we do welcome your individual calls. We're keeping up pretty well with the volume of calls we've received right now, but we are a small staff. So this is a great time to ask if you have any questions. think we'll give it about 1 more minute and see if anyone else types in questions. And if not, we'll end the webinar early. Okay, we have another question. The applications ask if you have any other funding. How important is it to have other funding when applying for the grant? It is not a requirement. For major initiatives and large grants, it is one very good way of demonstrating that you've got broad-based support for your project if you have another grant, or if you're willing to or able to devote in-kind contributions from your staff or partner organizations. So there's no hard requirement there, but it's just one of the things we look, especially for a large grant or major initiative, that we really do want to see broad-based support for these projects, because we think that contributes then to better sustainability after our grant is done. Well said. Okay, will these slides be available to webinar attendees? The answer is yes. We'll be archiving the slides, and I believe we recorded this. I'm not 100% sure, but we'll be aiming to archive the recorded presentation as well. Okay, and then we have another question, which is, sorry if I missed this from a previous answer, but when do you expect funds to be released for awarded large grant proposals? So roughly 30 days or so from the time of the award. Again, there's that grant agreement negotiation that you know, we'll offer you a grant agreement at the time we notify you that the grant has been approved, and then it would depend on how long it takes to sign off on the grant agreement, but we'd expect within 30 days. Great questions, everybody. Keep them coming. We've got plenty more time. Okay, and again, it looks like we may be through the current questions, so we'll stay on for another minute or so, and then, you know, we can always finish early if we answered all of your questions. Okay, everyone. Well, it looks like we've probably gotten through all the questions that you had for us today. Again, as you get into doing your proposals, which we hope you will, don't hesitate to contact me or the staff. We're happy to talk you through the basics of the process or any specific questions you have on your proposal. All right. Thank you very, very much for attending today. We're going to go ahead and end the webinar.